Hello, so I'm going to talk to you about the FCP roadmap. Many of you are aware that being an FCP in primary care requires you to demonstrate that you are capable and competent to be in these roles. And we need to be able to demonstrate anyone who's in these posts at the moment are capable by 2022 in April. So there are certain things that you need to fulfill to make sure you get there. And so I'm going to talk specifically to stage 1 of that process. So what you need to do for stage 1 is you need to do 2 things. You need to do the e-learning modules, and there are 2 different types. The first one is the musculoskeletal primary care modules, and there are 8 modules that you need to complete, and you need to have a certificate for each of those modules to prove that you have done the modules. The second part is around personalised care. There are 3 different modules that you need to complete, and that is the shared decision making, the personalised care and support planning, and the core skills. The link that you can see in front of you is the correct link. The link in the roadmap is wrong. They've removed all the resources somewhere else, and that link no longer works. So it's really important you use this link. Again, you will need to make sure you have certificates to prove that you have completed these modules. The other part is that you need to demonstrate that you have done the KSA evidence, so the knowledge, skills and attributes, and I'll talk about that in a second. So if you are an MACP member, if you're a full member, this will cover the knowledge, skills and attributes element of stage 1, but you will need to provide a certificate of your membership to the MACP as evidence of that KSA. You will still be required to do the modules as in the previous slide and provide certificates as evidence, and this will be stage 1 completed. If you are a member of the SOM, so Society of Medicine, then existing members will have to do a 1-day top-up to fulfill all of the KSAs. Those undertaking the new diploma, which we ready this year sometime, this will fulfill all of the KSA. So again, you'd need to have a certificate to prove that you're a member of the SOM, and you'll still need to do those e-modules as per previously. You might want to plan to do an FCP module. And so if you do that, this is available at a number of universities, but only 4 currently. There are some others coming online, but currently these are the only 4 that you can do this. This will cover both stages 1 and 2. So what happens if you're not a member of the MACP or SOM or planning to do a module? Then what you'll need to do is you'll still need to do the e-modules, but you'll also need to provide a portfolio of evidence of the KSA. And what this means is you're going to have to provide 4 pieces of evidence to fulfill that KSA. And what we're looking for is a master's level of critical reflection and evaluation of your practice and the learning that you've acquired, looking at the current evidence and putting these into practice. What we think is that this, as I said, it is around about 4 pieces as providing that they are done in quality. So we're not looking for quantity, and we don't need hundreds of case studies. We need the quality to be there. So it's in-depth knowledge around what you're looking at in terms of your practice. So what we're looking for is we are looking for individuals that really can show us that they can reflect and that understand that you may not know everything. We're not expecting you to know everything, but what we're expecting you to do is to deal with 80% of what you see in your caseload. There may be 20% that you don't know how to manage them, but what you'll know is where to seek help to do that. So if I was examining you, or I was mentoring you on a clinical placement for the MACP, and we were talking about a case, what I'd be asking you is, tell me why you think it's this diagnosis. Tell me what's your evidence that it's this diagnosis. What are your differential diagnoses that you need to consider? Is there anything in that patient's history that might be suggestive of red flags or serious pathology? And if not, tell me why you don't think that is, or if you think there might be, tell me why. If you think you need to do investigations, why do you need to do investigations? How is that going to change your management? So it's about justifying why you're doing all the things that you're doing it's pulling on that evidence that you've read, and thinking about how you're going to plan and treat that individual as you go forwards. My advice would be, at this point, I would use cases that you might have seen in physiotherapy or advanced practice, because you're getting a bit more of a bigger picture of that individual. Whereas in FCP, those consultations are quite short and limited and may not give you all the information that you need. We will be looking to try and give you some examples about, in respect to those case studies, and give you some pointers, and we'll look at how we might help you set up a template to do that. But start that process now. But just remember, it's not quantity, it's the quality that we're really looking for. Next time, what we'll discuss, we'll discuss stage 2, and by that point we will have some clinical supervisors within our system that will support you with stage 2. So thank you for listening.